Welcome to Elevate the Game, where DFW's top leaders drop gems on success, strategy, and legacy with your hosts, George Abreu and Eric Bodiwala. Let's get into it.
Hey everyone, thanks for joining us today. Welcome to another episode of Elevate the Game. My name is Eric Bodiwala. I'll be your host today. And, just like every week, we're interviewing different players in their field and, sharing with our audience how, they can, well, how they're elevating their game in their space and hopefully how they can help you elevate your game in whatever it is you're doing. So, very excited to have Miss Antonia Chen with us today. She's a leader in the healthcare space. She's an orthopedic surgeon over at UT Southwestern, and she just recently got awarded Best of 2025 Doctors in D Magazine. So congratulations for that.
Thanks so
Um,
much.
she specializes mainly in like knee and hip replacements. Does some infection management. Totally past my wheelhouse, but we can talk about that super cool stuff. And let's dig into some of like the latest technology and innovations that are happening for you, Antonia, in the orthopedic space. So thanks for being here today.
Thanks for having me. I really appreciate it. It's always fun about elevating our game throughout the entire Metroplex and definitely throughout all different industries. In healthcare, we just keep trying to elevate to the next level. We're trying to keep up with other industries, which are obviously leaps and bounds moving ahead, and we are in healthcare as well too. So orthopedics is a really special space. We do a lot of hardware. We put a lot of implants in. We give you the gift of mobility back. And one of the biggest things that we've really advanced in is using technology in the operating room, using robotics, navigation, augmented reality to put implants in where they belong, put implants in where it's accurate and precise, and really making it, we call precision medicine and individualized medicine. How I'm doing a knee replacement, a hip replacement today is very different than how I did it 10 years ago. And it's
Yeah,
really cool to see that evolution to make it even better for our patients.
man, that's so cool. I mean, and look, if you're not growing, you're dying, right? So,
Exactly.
in whatever it is you're doing, you want to try to improve and be the best version of yourself every single day. I mean, at least that's how I wake up every day, and sounds like you do too. Um, so,
That's a good way
tell
of
us,
philosophy to live by.
oh, 100%. So, tell us a little bit about yourself, Antonia. How long have you been, in the space and an orthopedic surgeon, and where are you from, and what are some of your interests?
So I was born and raised in Delaware. I grew up in the wonderful Garden State of New Jersey. Please don't hate on me for that. Did all my training
Never.
up on the East Coast area, Connecticut, Pennsylvania, and went to Boston for my last job. So I was in Boston for about 7 years. There I was chief of hip and knee replacement division and director of research, and then came down here to be chair of orthopedics here at UT Southwestern about a year and 3 months ago. But who's counting? But it's been great being here, and it's one of those things where it's fun to see the evolution of different practice patterns, different practice patients in different areas. But
Mhm.
throughout all the different systems and different areas I've been in, really what it comes down to is the patients want good outcomes, and they want to improve from the surgeries that they get.
No, 100%. So, I think, it's so fascinating how technology is, finding its way into every single business, right? And it's helping us improve, it's helping us do things better, faster, and maybe more efficient as well, right? So what you mentioned like surgery 10 years ago was totally different than what it is today. Like, so just on a day-to-day example, like what's one thing, like when you're in the operating room, what has technology done to make your life easier when you're in the operating room? Like something that somebody
Robotics
doesn't
is
really know, right? Like from your point of view, like what's easier?
So I would say robotics has been a bigger change, but robotics in orthopedics is different from robotics in general surgery. So think of a robotics in general surgery where you put your hands in a console and you operate and you kind of play like a video game essentially. And playing that
Yeah.
video game, you can do your surgeries. In orthopedics, robotics is more of a tool. So you use a tool to make cuts and put everything in. And one of the things I found that was really interesting from doing robotics, which is totally separate from the accuracy, precision, the good outcomes of surgery from a robotic side is actually the ergonomics being better. So one of the things that orthopedic surgeons particularly, but surgeons in general, we spend a lot of time on our feet. We spend a lot of time using our hands. It's a big burden on our shoulders, our hands, our low backs. We have a
Hmm.
lot of strains and pains from that. In fact, orthopedic surgeons have a higher rate of musculoskeletal injuries and surgery from performing surgery for other patients,
Yeah.
ironically. So what I noticed actually with robotics is I was standing up straighter, I was looking more ahead than I was looking down, and that just helps with longevity. So that's from an
Mm.
easy perspective for the surgeon, not necessarily patient outcomes, that I
Yeah.
noticed actually doing robotics, which has been really fun to use in surgery.
Yeah, that's so cool. Yeah, and it's funny. I have a couple other friends that are doctors, and they always say like they're always like looking down, right? And they have like, herniated discs in their spine because of it, just being in the surgery room all day. So
The neck
look at
hurts.
that. Technology is already improving your health in more ways than one. It's improving the doctor's health and it's improving the patient's health with more precision, right? I guess you would say.
Eh, And that's the goal, the question that always people always ask is accuracy versus precision. I can give you
Yeah.
precision, right? You tell me that this is the target, the robot can execute that target. Is that actually the accurate place we should be going? That's what time will tell, and that's what we need the individualized, personalized medicine for. But for
Yeah.
right now, it can actually give us the precision that we can't dial in. I always tell patients this, like I can't cut 1 degree of slope to 2 degrees of slope, right? I can estimate it, but to really go just from 1 degree to 2 degrees, you need something more precise than just the human eye and the human hand. And so that's
Yeah.
where it's really nice to get that precision from a robotic perspective.
Nice. What about efficiency, right? Like, well, I mean, I guess there's several ways of looking at that, but are you doing more surgeries because of technology? Is it, you
Uh,
know,
It's a good question. I think that initially people say there's a learning curve, and with this learning curve, it takes time to learn a new technology. So actually, in fact, you're probably slower in the beginning when you're starting
yeah.
new technology. So that takes more time. So you're not necessarily doing more surgeries. I think what happens is surgeons become at least equal in their time frame. Sometimes a little bit faster with technology. It's not so fast that you can do a case in 10 minutes when generally takes 1 hour, for example.
Yeah.
The
Yeah.
differential is not that big because it's a tool, not necessarily something that makes it much more efficient. What I
Hmm.
think it helps with efficiency is really complex cases. So cases that would take potentially a lot longer historically because you don't know exactly where the anatomy is, where things go, et cetera. You can actually be able to put it in an appropriate manner and actually shorten that time frame so you have a little more confidence in where you're placing your implants and doing things like that. So I think efficiency is next. What I really think is neat is a lot of these cameras, for example, that come with our robotic systems can scan
Hmm.
a room and say, hey, this person should be doing this job and this person should do this job and make it just much more efficient. Imagine a consultant coming in and say, hey, look, we need to change all these things because they can see it. Well, now with AI, they know what the algorithms are, what it should be, what you need to
Hmm.
do to bring it in. And that's what I think going forward, the efficiencies will come. But right now, I think it's more of a tool than it is an efficiency builder.
Nice. So when somebody like when a patient comes to see you and says, "Hey, I have this problem, whatever, my knees bother me, or I need a new knee, or whatever it is," are you guys telling them, that you're using technology more now? Like, is that like not necessarily a sales pitch, but are you using it as a tool to tell them that your surgery is going to be better or improved or more precise because of this?
It's really interesting. A lot of patients not come in asking for it. They've heard of robotics, they heard of technology, and they actually seek it out. We put it out there that we do a lot of robotic surgeries here, and patients come in saying, "I do want robotic surgery, or I want robotic surgery, a specific approach in this way." So the
Mm,
consumers now, I know they have these mugs that say, "Don't confuse." My MD with your Google degree, and now it's ChatGPT degree, right?
yeah,
Because everyone goes online and looks for these things, but there is some truth to it. So, for example, I do hip replacements and I do something called direct anterior hip replacements. Well, when direct anterior first came out, a lot of people would say, oh, that's a marketing ploy. There are some studies that show that there is somewhat faster recovery, but patients do really well with direct anterior, with posterior, a bunch of different approaches that work well. But some
mhm,
patients, consumers come in saying, I want this specific approach. So I don't have to sell it in all honesty. Most patients come in asking for it. But I do tell patients about it. And most of the time, patients, there's two responses actually. One response is, I don't want a robot doing the surgery. I want you doing the surgery.
yeah,
And so I explain to them that I use the robot as a tool to do their surgery, but I'm doing their surgery. On the flip side, some patients are like, oh, that's really neat. I like the precision and I want to do that for my surgery. So it's really
yeah,
neat to see that interest there when it comes to technology. And patients are using technology in all of the parts of their life. Why wouldn't they use it for their
yeah.
healthcare as well?
Absolutely. Yeah, I know. It seems like everybody nowadays is like it's almost like they're expecting it, you know.
They
Thankfully
are.
I've never had any surgeries, so I'm not I
Knock on
haven't
wood.
yeah, knock on wood, right? I think, I did have a herniated disc one time in my back, but I was able to heal myself with yoga, which
Good
was
work.
great. Man, I did like 200 hours of yoga and it healed me, pushed that jelly back in, right? But anyway, it's crazy just how the world has changed and people are like, hey, like, are you going to be using robots to help
Yep.
me, to fix my knee or my hip
100%.
or whatever it is. So it's wild how much we have evolved. Um, so over at UT Southwestern, I mean, I'm sure you guys are doing a ton of stuff and always growing there. And it seems like you've written, I think, a couple books, and you're more of an advocate really, and running several programs there. Tell us a little bit about that. What are some of the things that you guys are what are some of the initiatives that you guys are doing at UT Southwestern that you want people to know about?
I think the biggest initiatives at UT Southwestern fall into three categories, which is true for a lot of academic centers. One is clinical. We really want to build up our clinical presence. We're hiring all new surgeons in different fields. We want to be the forefront of sports, of foot and ankle, of hand, of spine, of tumor, of trauma, of joints. We want to, be that person you think, hey, who should I go to for surgery? So, for example, from a sports perspective, we just became the team docs for the Mavericks, which is
Oh,
really
wow.
fun. So, taking care of high level professional athletes, but we also take care of Dallas Trinity FC, which is the women's professional sports soccer team, FC Dallas, which is the men's professional soccer team, Dallas Pulse, which is women's volleyball. We just have, and UTD. We have a lot of partnerships with these different organizations to take care of their athletes. And it's not just the athletes, right? We take care of the staff, we take care of their family members and things like that. I think just
Yeah.
goes to show that we're really building our programs here at UT Southwestern to take care of as many people as possible in the best possible caliber. The other way is education. Our residents are top notch. This is a residency program that has been in existence for over 100 years. And our residents are excellent. And we keep wanting
Mhm.
to shape their education so that when they leave here, they're the best and the brightest as orthopedic surgeons. And that last bit is research. We want to be at the forefront of research as well too. There's a bunch of different areas. We talked about infection. We're looking in the infection space to try to help reduce infections, whether it's alternating magnetic fields or using peptides. We also have collaborations with our infectious disease folks to come up with new types of cement to help to prevent infections. So that's one big area of space. Prevention of infections, vitamin D is another area too. We also look at our trauma colleagues as well too. Different techniques in surgery, we call tightrope techniques that are revolutionizing how we treat pelvis fractures. Again,
Mhm.
more minimally invasive, less invasive, I guess surgery is a better way to put it. Faster, better outcomes for our patients. We're on the forefront of all of that to try to make our patients recover even better in the surgery they undergo.
That's great. I mean, it sounds like you guys are doing a whole lot over there. Obviously, UT Southwestern is a world-class organization. If you're taking on more professional athletes, those guys need the best surgery, right? Because they need to go out there sooner than later and perform
Yep.
and use their bodies at a high level. So that's awesome. So what type of any challenges that you're seeing, in your space right now, with growing or whatever initiatives? I mean, what type of challenges are you seeing in your space right now?
The same challenges that probably everyone's facing, financial challenges. So the hard
Yeah.
part about technology, right, is technology costs money, but
Yep.
technology is excellent, interesting, and in order to accelerate and improve healthcare, we need to implement these technologies to get the data to, fit our algorithms so that we can improve patient care for patients as we keep on going. But to
Mhm.
get that, we need money to make that happen, right? So reimbursements are going down. That's a big thing from the national government, as you can imagine.
Yeah.
Insurances are harder, pre-authorizations, all these things that people fight for. There's only so much money in the pot, right? And
Yeah.
so, what do we apply it to? How do we use it effectively? How do we use it wisely to try to get the results that we need to best serve our patients and so best serve our trainees and things like that? So that is the biggest challenge: is where to wisely put our resources to get the most bang for our buck.
Yeah, no, it makes sense. Yeah, it's a crazy world right now. It's funny you say financial troubles, right? I think like the economy in general is still down.
Yeah,
I think just in general, right? Gas prices have come down, which is great. Probably the lowest they've been in a long time, but grocery prices are still high.
yeah,
We still see a lot of that in the apartment space. We have, we'll own like Class C apartment buildings, which is really where like workforce housing or blue collar workers. And a lot of these people are still losing their jobs. We hear a lot of people say, "Hey, we can't pay rent. We're going to move in with our parents." So I think in general, across the board, the people are working towards trying to thrive again, right? I think in the real estate space, people have said survive through 2025 and thrive in 2026. So we'll
we
see.
like that.
Yeah, we'll see what the new year brings. At least in our space, as interest rates come down, and the economy starts to pick up, right? Real estate has a big, factor in the economy in general, right? Um,
Huge.
so I think,
It's indicative of how the economy is doing.
100%. Yeah. When that space is doing well, normally others are doing well because it branches out in so many levels. Um, question for you. So a lot of, speaking of just finances, right? A lot of people, a lot of our listeners, are always trying to create passive income or figure out a way that they can grow and, maybe replace their current active income. What are your thoughts on, passive income? And maybe just some of the things that you may be doing for passive income, if any.
So the word passive income is such an interesting one because most of the time, if I'm getting income outside of the job that I'm doing, it's not that passive. So that's what's
Yeah,
interesting, right? I,
if
I
you're
think
putting
of
in the
passive
work.
as, yeah, it's exactly like I want to be sitting on a beach and money's just flowing in, but I think everyone wants that, of course.
Yeah,
I think there's two factors come into it. One, if you ever do anything that's passive, quote passive, do something that you're passionate about because otherwise there is work involved in it. From an orthopedic surgery standpoint, passive, quote passive income comes typically in the form of consulting. So, my active income is working at the university, taking care of patients, and that's an active income. And the passive income is doing consulting work outside of my university time. And it's been really fun to be able to do so in areas that I'm interested in. So infection space, for example,
hmm,
companies I pair with, we try to look at ways to reduce infection, whether it be with dressings or sutures or other preventive measures. That's one way to do it. Also with implant companies. So I do hip and knee replacements. The implant companies that I work with, we're trying to make the next best, brightest, shiniest implant that's going to go into patients and feel natural and give you the best possible outcomes. And so there's constant innovating. Well, so as I say, it's not truly passive. Someone's got to design those implants. Someone has to come and put those ideas together. But
yeah,
it is outside of my regular realm of work, and it brings me joy. Honestly, it's a really cool way to give back. Besides the direct patient care of operating and seeing patients,
yeah,
and it's a really nice way that orthopedic surgeons typically do that. If you're looking for passive income, though, real estate's a really good way to go. But if you're managing
yeah.
your real estate, that's not so passive either. So
No, I'm
it
with
takes
you,
a lot
right?
of
Like,
money.
everyone has a dream of, owning a bunch of rentals and, but at the end of the day, you're in the landlord business, right? You're dealing in the
Yeah.
people business, right? You're dealing with tenants and sometimes those tenants can be problematic and, sure, you can have a management company, but then you're managing the management company, right? So like you said, you're always putting in work, but I think,
You are.
I mean, you nailed it. Like the most important thing is whatever you do, make sure you're passionate about it. I mean,
Yeah.
if you're not living a life of passion, then, what are you living for? Right?
Right. Exactly. You have to like
Um,
what you're doing for sure.
yep, 100%. So, as we're wrapping up, Antonia, what are some of the exciting plans for 2026? What's the outlook for 2026? What are some of the goals you're trying to reach? And, what do you see happening in your space next year?
So thriving 2026, I like that as a motto.
Let's
I think the
go.
biggest
All of
thing,
us, right?
it's all the way, passive income, bringing things on, accelerating the future and technologies of healthcare. And our biggest growth, at least for the next year, really will be bringing on new faculty members.
Yeah,
We have historically done a lot of faculty members who have worked here, which are excellent, and we are bringing back one of our own residents. But I think the next thing is really kind of continuing to build our world-class faculty members here. So you come and see us who are at the forefront of technology. Our new sports guy, forefront of technology, our new joints people, forefront of technology. We're just going to keep bringing that forward more and more so that we can accelerate patient care here. And we're looking to hire at least 5 more people to join our team in different subspecialties. So it's an exciting time. If you come back in the end of 2026, 2027, it'll be a different team. And I'm really excited about that outlook.
nice. Well, hopefully there's some potential future faculty members listening here today. So, what's a good way to, if anyone wants to just reach out to you and get in touch, what's the best way to reach you?
Best way is email. I'm really bad about text messages or LinkedIn, but email is the best way to go. It's pretty straightforward. Antonia.chen at utsouthwestern.edu.
Awesome. Well, there you go. Antonia, this was fantastic. Thanks so much for spending time with us today and telling us about what you do. I mean, it sounds like you guys have some awesome things happening at UT Southwestern. At the end of the day, you're in the business of helping people, right? And making them feel better and,
That's the goal.
moving on with their lives. So, we appreciate your work. Hopefully I never have to go there. Knock on wood.
Please avoid us. I would say see me socially, but not clinically. How's that?
Yeah, absolutely. We can hang out socially for sure. Just not
Done.
in the clinic.
Smart.
And hopefully we all maintain good health. But let's hang on for a couple minutes here, Antonio, so we can chat. But thanks so much for
Okay.
joining here and thanks for elevating the game today. Hopefully our listeners were able to get some takeaways and maybe as a faculty member sitting out there someday. that may join you.
Love to have you. Thanks so much
Appreciate
for
your,
having me.
yeah, appreciate your time here. Thank you.
Thanks for listening to Elevate the Game. If you're a mover and shaker in DFW with game to share, apply to be a guest at elevatethegamepodcast.com/guest.